Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Calls for the resignation of Robert F. Kennedy Jr. from his position within the Department of Health and Human Services are intensifying as more than 1,000 employees voice concerns over his controversial public health views. Supporters of RFK Jr. are arguing that his presence brings a much-needed outsider's perspective to government, while critics say his track record on vaccines and science undermines the agency's mission. So, what's at stake in this debate? And how could his continued role as the head of Health and Human Services shape the future of public health policy? Well, joining us today is Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak, to help break all of this down for us. Hi, Dr. Pate.
Hi, Gemma.
And folks, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. So, Dr. Pate, I want to begin today by discussing an op-ed that ran in the New York Times. It was written by numerous former directors of the CDC that dates all the way back to 1977. And I think it's fair to say that they took the gloves off in this op-ed and calling for the resignation of Kennedy, collectively saying that he is endangering the health and the lives of every American. What was your takeaway from this op-ed?
Well, I thought they were right on, and listeners should realize in what you just said, that means these were CDC directors under Republican and Democratic administrations going back to 1977. And I do think that means something, and that their editorial, I thought, was very, very sound. In fact, I don't know that it went far enough in explaining all of the dangers that we face, but these directors pointed out that this approach of the secretary is undermining public health. We now have so much turmoil at the CDC and have lost such a brain trust of longtime leaders of various areas that it is an issue that it will not only impact the United States public health, but actually our biosecurity.
Dr. Payne, I want to read an excerpt from the op-ed that they wrote. So this is an excerpt. So, quote, Mr. Kennedy has fired thousands of federal health workers and severely weakened programs designed to protect Americans from cancer, heart attacks, strokes, lead poisoning, injury, violence, and more. Amid the largest measles outbreak in the United States in a generation, he's focused on unproven treatments while downplaying vaccines. He canceled investments in promising medical research that will leave us ill-prepared for future health emergencies. He replaced experts on federal health advisory committees with unqualified individuals who share his dangerous and unscientific views. He announced the end of U.S. support for global vaccination programs that protect millions of children and keep Americans safe, citing flawed research and making inaccurate statements. And he championed federal legislation that will cause millions of people with health insurance through Medicaid to lose their coverage. Firing Dr. Menarez, which led to the resignations of top CDC officials, adds considerable fuel to this raging fire, unquote. I read that, Dr. Pate, because it struck me it laid out all of the domino effects of the decision-making at Health and Human Services right now. Can we focus for a moment on the firing of Dr. Menarez, if I'm saying her last name right? This happened just a week ago. And what happened since then, if you can lay that out for folks, because she was just confirmed on July 31st, and she was praised by President Trump as being a scientific leader.
Yes, and in fact, when I was watching that confirmation process, Of course, she had great support from Senator Crapo from Idaho, well deserved. And in fact, I was trying to figure out, why is the Trump administration advocating for her? Because she does not seem like the kind of person that would be a good fit for RFK Jr., who would be her boss, and wouldn't seem like the logical person to kind of go along with a lot of the nonsense, as the FDA director has, the NIH director has. She seemed like this was out of place, and surely if I could see that, President Trump and his team saw it. So I was pleasantly surprised she got confirmed. But then, of course, it only took less than a month, I think, for the fallout, when she would not rubber stamp the findings that came out of this very illegitimate advisory committee for immunization practices out of the CDC, and that apparently is what led to her downfall. And so, very, very concerning. And of course, now what it means is that without her, the Secretary of Health is not a physician or somebody with scientific or medical knowledge. The CDC director that's been put in her place is not a physician or somebody with medical experience. He's more of an administrative type. So, and now, as you mentioned, we have had fallout, and we have lost four more really top notch CDC leaders. We lost Dr. Daniel Jernigan, and he was the director for the National Center for Emerging Zoonotic Infectious Diseases. Your listeners will remember that zoonotic means transmitted from animals to humans, which is what
Mm-hmm.
has caused our past pandemics, including the COVID-19 one. And yet now that division is left leaderless. He's also, you and I have talked on past shows about the risk for vector borne diseases. Vector borne means mosquitoes, ticks, flies. We've talked about chikungunya, we talked about dengue, West Nile virus. So he was also over that area. And another area that you and I talked about in the past was the emerging threat of fungi, fungal
Mm-hmm.
infections, particularly hospital related. And he was over that area. So now that whole area that presents many, many threats to the public is leaderless. Dr. Jennifer Layden, who was leading the Office of Public Health Data Surveillance and Technology, that position is now vacant. And of course, the reason that I've been able to provide your listeners with guidance these past 5 years is because I could access the data and the results of surveillance. And now that area is vacant. Dr. Dimitri Daskalakis is gone. He resigned now, and he was the director for the CDC National Center for Immunization and Respiratory Diseases, which, of course, COVID is one, but RSV, influenza, those kind of things. And as you and I have talked about many times on this show, one of the major potential threats for a next pandemic is the avian influenza. And so he was heavily involved in that. And then Dr. Deborah Horry, who was the deputy director for program and science and the chief medical officer for the CDC. So we've lost a lot of talent. And then you add to that we lost the leader at the White House Office for Pandemic Preparedness, and that position is vacant. And what all of these leaders have said, either in their resignation letters or on public interviews following their resignations, is that all of this is leaving the United States less prepared. I totally agree. If we have a new emerging threat, a novel virus like we've dealt with many times before, or other organism, we really have minimal capabilities to respond to that. And so it's just a disaster waiting to happen.
And Dr. Pate, outside of this op-ed, with the four people that you mentioned, the four doctors who resigned from the CDC after the firing of Dr. Moneros, they have been vocal. Some of them doing interviews. You mentioned Dr. Daskalakis. He did an interview and was very open. One of the things he said was, in the time since RFK Jr. has been in this position, so I believe sometime since January, February, he has not once met with CDC officials. They've tried to meet with him. They have not been able to. So, what Dr. Daskalakis has said is that we don't know where he's getting information because it's not coming from the CDC. Why is that important for people to understand? Because even in this op-ed, these former CDC directors said, "Look, this should not be political. We worked, as you mentioned, under Republicans, under Democrats. At times, you may not, you might have a back and forth, but presidents always understood that public health was important, and you look to the CDC and Health and Human Services for the data, for the science."
Well, absolutely. And so I was very concerned when I heard that, and I certainly would encourage your listeners to listen to that interview. It hit me very hard because I've been the leader of an organization where I had to make decisions where not all of my team agreed with the direction we should go or how I should decide. But I listened to all of my internal experts. And then I made a decision having heard all of the points of view, evidence, etc. What is scary here is a secretary of Health and Human Services who is not even wanting to know what is the data that the CDC has. What do those experts who have been in the field for decades, what do they think or make of this? And it'd be one thing if RFK Jr. had specialized knowledge and expertise, but he has admitted many times that no one should be taking medical advice from him, which I wholeheartedly agree with. Yet he is listening to outside sources, and what we believe that those are ideological sources, not science based sources, and not even getting the other side of it in which to contemplate and balance to make decisions. So it just tells you that this is being all driven by ideology and bias, not science.
And before we go to break, Dr. Pate, another thing that stood out to me in this op-ed by the former CDC directors was, they say state and local governments need to fill funding gaps where they can. They even go on to say philanthropy and private sector, they must step up to their community and make investment. And finally, they stated that medical groups need to continue to stand up for science and truth. How important are those three factors in the space that we are living in right now?
Hugely important. And that's why I mentioned I'm very proud of the American Academy of Pediatrics, the Infectious Disease Society of America, the American College of Obstetrics and Gynecology, the American College of Cardiology. These are some professional organizations that have come out and said, look, let us give you the information, our best recommendations based on what the science is. And it looks to me as though uh, their guidance may replace the guidance that we used to get from the CDC's advisory committee, and that insurance companies are starting to look at those professional societies. But more than that, we just saw New Mexico take a stand. The Secretary of Health just issued an order saying that the COVID vaccines are safe and effective, and they are in the interests of their state health department. And so what they are doing is she issued an order that their board of pharmacy should work with the Department of Health to expand access to the vaccines instead of
Mm,
restricting it and to make it more available. Now, that's counterbalanced by the state of Florida. It just came out and said they're going to
hmm
get rid of all vaccine mandates. So, it's going to be extremely important. A lot of healthcare organizations have wanted to stay out of the fray. I understand that. I think that's a mistake. I've talked with a number of health systems that this is the time they're going to have to stand up because the the answer is going to become apparent. I can't tell you whether it's next year or in 3 years or in 5 years or when, but we know what the science tells us. And you can defy gravity so many times, but it is going to eventually impact you. And the same thing is going to happen here. We are going to have some bad things happen. And I think that when that happens, the people who have embraced conspiracy theories, disinformation, they don't give those leaders that complied with it a break. History tells us they come right after them when bad things happen. Bad things are going to happen, and people are going to look for who to blame. And it's important that private organizations, health systems, departments of health, states stand up for truth because the truth will become apparent eventually, and then there's going to be a political price to pay.
I want to focus this last segment with you today on the COVID vaccine. We have an updated COVID vaccine. However, there are new FDA limits on it. Can you talk a little bit about this? Because what this does basically is make it no longer eligible for certain people to receive it, or at least it makes it much more difficult.
Well, you're exactly correct. However, if you have the information, you have more options than you think. First of all, the CDC has already indicated that just based on the list of at risk conditions, 74% of adults would qualify for the vaccine and coverage for the vaccine. So there's two issues. One, will you be able to have somebody that can give you the vaccine? And two, will it be covered by your insurer? And so the first thing is more people are eligible than realize it. In my last blog piece, I wrote out a very detailed list. Most of the lists that you see in publications is an abbreviated list. And for example, it'll list disabilities with a symbol indicating that there's a lot more, but they don't list those in that. You have to go to a different place to find those. There's
Mm,
quite a long list of things that put you at risk. And in fact, I think that you'll find that most people, including kids, will be able to find factors. Now, what it may mean is that you have to discuss it with your doctor. You might need an order from your doctor in order to have the pharmacy give it. But look at that list on my blog. Most publications also only list the list of at-risk conditions for which there is conclusive evidence that you are at high risk. That is not the requirement for coverage that I've seen anywhere. Plus, a lot of insurance companies are expanding the conditions that they'll cover because they realize it is far less expensive for them to pay for a $200 shot than a $20,000 or $200,000 hospitalization. So you can find things on that list if you look at that. Also, there's no indication, and in fact, I think even the secretary has made comments that would support my argument that it has to be only the at-risk conditions listed on the CDC website. For example, the American Academy of Pediatrics, which I mentioned, has come out and said that young children are in the high risk category, those under the age of 2. And so your pediatrician may be likely to give you that prescription that says your child should be vaccinated. So do your research. You may need that to show your doctor, because no doctor can memorize all of these conditions. But I've got sources on my blog. You can also look to those different professional societies for their guidance, and more people can get vaccinated than think.
And Dr. Pate, with that, I mean, it seems like what this is doing, it is making the process harder. And if you can pay out of pocket, some health experts are saying it could be upwards of $225 to get the COVID shot. Um, that is then breaking it up into have and have nots. And then, yes, doing your research, it is just making it more difficult. So, best advice for people moving forward who want to get the vaccine, because wasn't this the whole argument during the pandemic, was if I don't want to get it, I shouldn't have to get it. And now it's if I want to get it, I don't know how to get it.
Well, well, you're absolutely right. The irony is not lost on many that this is an overreaction. I understand people got worked up because they thought they would be required to get vaccinated and so forth. But this is an overreach and an opposite, exaggerated reaction to make it difficult for even people that want to get vaccinated. The director of the FDA and even well, let me just leave it there. The director of the FDA has admitted it is going to be more challenging, but that everyone can get vaccinated who wants to. Now, as you mentioned, some of those people may have to pay for the vaccine, but frankly, you're just going to have to do your research. It is going to be much
Mm-hmm.
more difficult. I'm trying to help people. You can certainly look to my blog for some help, but talk to your doctor, and particularly if you can go in forearmed with either that information, because I give the links to the additional CDC site where there's a whole nother list of expanded conditions, or you go to these professional societies list. And even I've already talked to some folks in Texas and other places. Not all pharmacies are refusing this. In fact, many just ask that you self-attest that you're in one of these high-risk categories. So you may not even need a prescription from your doctor, but that is one way that you can get it if you're having trouble getting the vaccine.
I have less than a minute left with you, Dr. Pate. Should people be waiting on the flu shot as well? I know it's available, but and I ask this because anecdotally, I've heard people being concerned about, well, what if I should get the flu shot now? Because what if the same thing happens with the flu shot that happens with the COVID vaccine?
Yeah, I follow pretty closely what's on the radar. I don't think the flu shot is on the radar yet. I think they're going to go after HPV and hepatitis B first. So I'm not terribly worried about the flu vaccine. It is too early to get your flu vaccine
Mm-hmm.
now. As we talked about, that protection wanes. We want to time that to when we're seeing flu activity begin. And I will certainly let your listeners know when I see that activity beginning that it's time to get their flu shot. I'm getting my COVID vaccine today. I am worried that one is that we are going to lose access to that in the next upcoming months. But I'm getting that
Mm-hmm.
today, but I'm holding off on my flu vaccine until I see activity.
All right. Well, as always, Dr. Pate, we appreciate you. We've been talking with Dr. Pate. He is the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. If you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. And if you want a list of all of those pre-existing conditions that Dr. Pate mentioned, go to his blog, Dr. Pate's blog. I was looking at it as we were talking. He has 78 pre-existing conditions on there. So take a look at that. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.